We are going to do microblading on Sherry's brows today. Now she has had permanent makeup on her brows before, so she has a what we call a powdered brow, so it looks like pencil. I'm not thinking that I really need to do much measuring because she's already has the powdered brow look, but I'm just going to go over and make sure everything's where it should be. Actually, this one we can bring in a little bit. So she's pretty symmetrical. This brow is a little bit longer. She's lost a little more color on this one. So the first thing I'm going to do is I'm just going to put some purple dots on her. So I'm going to bring this one in a little bit. That one is where it should be. And I like where the arch already is. And then we're going to bring it down.
And she's not doing a young girl brow on me because this girl is 65. So there's always help, you ladies.
So I'm going to pick out a color. And I think it's going to be brown toffee, but we'll see. So I'm going to leave that set just for a minute, but I'm thinking that's the color that I'm going to use. So I'm going to use brown toffee, and then I will add a little bit of product called Ungray, because sometimes colors will want to change a little bit with your undertones. So I'm going to prevent that. I use a couple different blades. Usually when I start, I will use, it's called a U blade, and it looks like a U, and do the parameter of the brow. And then I will do some more numbing, and then I'll do the center of the brow. And then after I've gotten most of it done, then I like to go back in with a little bitty tiny blade and just make more hairline strokes in between the hairline strokes I already have, and just add a little bit more dimension to it. So I'm just barely dipping into my color. I'm going to stretch her skin. Is that okay in that
Yes,
area?
it's just fine.
And then I'm just going to go around the parameter. I'm going to pull you a little bit this way, Sherry. And I don't mind if she has a little pinpoint bleeding. She might have a little bit more. That's why I want you off any aspirin products. And she has been taking a baby aspirin, so she might get a little more bleeding than most. And then I'm going to the bottom. Just add a few little straight up and down strokes here. And then I'm going to do the parameter on the bottom.
It doesn't hurt.
It kind of should feel like scratching.
Yeah.
Even though you've had some numbing on.
Mm-hmm.
So that's the parameter, and I just kind of will wipe it off. And then I scrub in the color, which essentially means that I'm just rubbing in the color into where I just made those little hairline strokes. And that's going to set on that brow while I'm working on the other. This part for some people can feel just a little stingy.
It doesn't to me at all.
This is the part where people will take their picture of their brow and then they send it to people and say, look at my beautiful brows.
Does it look like a caterpillar?
Yeah.
What should I do afterwards?
You are going to, for the next couple hours, I will send you some pieces of gauze and I will want you to wipe over the area with a wet piece of gauze.
Okay.
Because you are going to have a little bit, since you're bleeding a little bit, that will want to get crusty.
Okay.
And if you wipe over it, then you will not, it won't get crusty. It just will heal
Okay.
prettier.
Do I just use water?
Yeah, you're just going to
Okay.
use some water. And then you are going to, just for a few hours, and then you're going to apply some more Vaseline
Okay.
on the area after that. Vaseline is your friend. It's like a liquid Band-Aid, and I want that to stay on the area for about a week.
Okay.
So I'm just going to add some more here on the bottom. This one pretty okay, numb-wise?
Yes. Feels fine. Will the
And then
color
here
be
you
this?
just have some stray hairs that I'm going to like take out
Okay.
too.
And will the color stay the same, or does it get?
The color's going to lighten over a period of time.
Okay.
With microblading, you should probably have this touched up every 18 months to 2 years.
Oh, that's not bad.
It doesn't last as long as a powder brow because really you're not going as deep. With the powder brow, you're going into the dermis with a piece of a tattoo equipment. But this is really nice because it just looks really natural with those little hairline strokes.
I was happy with my powder brows too. I think it's been probably 8 or 9 years since I had them done. Maybe.
Yeah, they last pretty well. Okay, so this one, I'm just going to scrub in like I did the other one. And then I'm going to go to the other side and take that color off and add some numbing product so I can do the center. And that numbing product will, sit for about 3 to 5 minutes. And it's a numbing gel. It's different
Can I
than what
look?
Oh yeah, you can look.
Oh boy.
Yeah, isn't that lovely?
It looks like I have bilateral caterpillars. Oh, I'm anxious. I like the color.
Yeah, this color was starting to change on you, but it's been a lot
It's
of
been
years.
a long time. So you've done the outside of my brow?
Yeah, both of the outside of the brows are done. Now when I get to the end, I will look through them again and see if I need to put any smaller hairline strokes in there.
Okay.
Just to, I guess, kind of perfect it.
Uh-huh.
And I'll get my fingerprints off of you here. Oh yeah, that color's gonna be great.
Great. So nice not to have to do my brows. Patty also did my permanent eyeliner, so in the morning I never have to do that either.
So I'm just adding another layer of this numbing.
Okay.
Then sometime this week I'll just clean up the strays
Okay.
you got underneath there. Okay, Sherry's tough, so I'm gonna start. So this I'm just gonna kind of move her hair out of my way and do some strokes in the center portion of it.
Feels fine. It's not uncomfortable.
And like I said, Sherry has a little more bleeding going on than most people have. And that's honestly just because she was taking some baby aspirin. And that's why I have you quit taking everything. I'm just looking back through, see if there's any places where I can add some more strokes.
Okay.
I might put a few more on the end here. Okay, so I'm going to scrub this one all back in again.
Okay. Get the caterpillar back?
Yeah. Now the purple dots that I put on her, which is just a surgical pin, they'll come off in about a day just with the using the Vaseline. I don't try to get those off because you have to use alcohol, and that would not feel very good. I'm going to put Vaseline on it. I'm going to grab you a an ice pack that I will want you to use.
All right.
Several times.
Okay.
I do not want you doing any like major aerobic activity.
Okay.
In the next like 3 days. You could still walk.
Okay.
You could lift weights. I just don't want you getting all sweaty.
All right.
Because if you do that, one, if you have swelling, it's going to make it worse.
Okay.
And two, if you sweat, it's going to sting.
All right. I won't do it. Not that I do anyway.
I'm still going to add a couple more lines in this front area.
Okay.
I kind of like to just build bit by bit. Okay, I'm going to add a couple more strokes right here in the front. A little bit more on the bottom there. And I'm just going to move your hair out of the way and just add some little strokes in there. I'll move you a little bit that way.
When you see patients for their consultation, do you kind of have them bring in a brow pencil or something, or show them
Oh yeah,
so they can show you?
I usually have them how they put their pencil, on. Because everyone has a little bit different way of doing their brows. And then I like to have the color of their pencil.
Okay. Yeah,
So normally I'll have them bring in their brow pencil just so I can see what color they're doing. And then really kind of how they're doing their brow. Because some people want it more straight in the front, some people want it more rounded, some people want them wider and bigger. And so yeah, it just gives me a good idea of what they want. And then, of course, I'm going to be within the parameters of where they should be.
Right.
You're not going to have brows up here.
Yeah.
Even if you want them. And Patty's not going to do them if that's where you want them.
Well, I've seen lots of your patients that you've done brows on, and they look great. So I know it must be very individualized. I don't use a brow pencil because I have that, tattooed brows already, but
Yeah,
it was
and
getting
that's,
a little,
you
my
know,
hair was getting a
that's
little
why I didn't
sparse.
have to do as much measuring with
Uh-huh.
you. Normally, I would take I would measure from the center of your nose and put a little measuring device on your forehead, make sure everything's centered.
Uh-huh.
But since we've already done them, we kind of know that they're where they need to be.
Mm-hmm.
I'm going to put a few more strokes here in this back area.
Okay.
And then I'm going to scrub that in and let that set for a bit.
Okay.
And then so what I'm going to do is I'm going to take the color off of this other side.
Okay.
And I'll just kind of look through it and make sure that there's plenty of color. And if I feel like it needs any little strokes in between, then I'm going to change out my blade and go to this little tiny,
Oh, okay.
super tiny.
A little bit smaller one.
See how it's soft?
Oh, yeah.
Yeah.
Yeah, that's really little.
Yeah.
Are you using a magnifying glass or something?
Yes, while I'm working, yes. I like to be up close and personal so I can make sure that we're putting the strokes where you want the strokes. And then, like I said, you have a few little strays here and a few strays underneath that aren't growing where we want them to grow, so
Okay.
we will want to get rid of those. Matter of fact, I'll just go get one of my little blades and
Okay.
get rid of that. I'll let you take a look at this brow, Sherry, but I
Alright.
am going to add some, just so you can see what it looks like so far.
Oh, yeah.
But I just feel like I can add a few little strokes in
sure.
between those bigger strokes.
Yeah, I like it a lot.
It's a great color, isn't
Yeah,
it?
it is. I like how you did the tail, too. And it's just a little bit thicker, isn't it?
Yeah.
Yeah, I like it a lot.
And we're going to get rid of this. I'm just being particular now, so.
I love being particular. Glad you are.
So then Sherry will come back in 4 weeks for a second treatment. Just kind of, I call her a color boost or perfecting treatment.
Okay.
So if she's lost any of the color, we can put it back in.
Okay.
And then she won't see me again for this treatment for about 18 months.
Okay.
Okay. So this last scrubbing in, I will leave that on for about 15 minutes.
Okay.
And I will grab a piece of saran wrap to put over that so it stays moist and it's just actually just absorbing into those little.
So that's the color that's going down into those little
Yes.
tiny cuts? Okay.
Yep. I know it sounds silly, but it's kind of relaxing, isn't it?
Yeah, it's really fine. I'm just excited about getting them. I don't lay down in the middle of the day like this.
Okay, I'm going to scrub that in too.
Okay.
And then we're just going to let this set for about 15 minutes.
Okay.
I'm going to grab some saran wrap, cover that up
Okay.
so it stays moist. Lay down. Okay, I'm gonna grab you an ice pack, and you
Okay.
can just kind of use it
All right.
over top of this if you want. You really don't have any swelling at this
Okay.
point, so. Just removing this XX color, and Sherry will be ready to go home.
Okay. So when do I see you again?
In 4 weeks.
Okay. And I keep the Vaseline on?
Yes, for a week.
Okay.
And then no makeup around this area.
All right.
I mean, if you should want to wear, you can still wear your face makeup. I just don't want it on your brow area.
Okay.
And then before you leave, I'm going to go grab my either tweezers or a blade and
Okay.
get rid of your stray hairs
All right,
there.
thank you.
Then that way you won't have to do anything.
Yeah.
Put a little Vaseline on 'em.
Okay.
And it doesn't have to be gooped on. You just want to put enough on it that it's moist.
Okay. What should I use? A Q-tip or something? Or?
You can use a Q-tip.
Okay.
Or you can just use clean hands.
All right.
I just want you to kind of just blot it on.
Okay. Is that what you're doing now?
Yeah, put
Okay.
a little. And then I'm going to go get tweezers
Okay.
and get the rest of that gone. Okay, and I'll let you take a peek at them.
All right. Oh, I really like them.
Yeah, I think
I
the
like
color's
how you
great.
brought that one in a little bit
And
more
I
too.
still might want to do a couple more strokes there, but
Okay.
you really
Yeah.
can't take it away. So
Yeah.
I prefer to be on the cautious
Uh-huh.
side.
I
we
like
can-
them a lot. I like
Yeah,
what you did.
and
there.
then so I'm just gonna get some tweezers and
Okay.
get rid of a couple of those stray
Okay.
hairs underneath there, and then
Great.
you'll be
Thank you,
done.
Patty.
You are welcome.